I think this is going to be an outstanding facility for our members. I think they're going to be working in the finest institution probably in Western New York.
I think it's a dream come true. I think that a state-of-the-art children's hospital is important to me. It's important to the staff, and more importantly, it's important to the patients that are going to be treated there.
Without the backing of the community, not just financially, but in every way imaginable, I don't know that this would have gotten off the ground.
The Children's Hospital is an integral part of the fabric of this community, and without the community's support, not just financial support, but emotional support and public support, that is a demonstrable show of support from the community.
The hospital was such an important asset to the community and an important asset to kids, which is my soft spot, so to speak. We don't have anything in the future if we don't have kids, and they need to be cared for, and this is one aspect of their care.
The community demonstrated to us how much they care about this institution, how much they care about their children, because that, after all, what we're doing is providing a safety blanket for this community so that whenever children have a serious injury, an accident, an illness, we have state-of-the-art, world-class facilities to provide those services in.
And I think part of what got this situation rolling was the decision to move the outpatient ambulatory off of Hodge Street over here. And so we could look at the community and say, we're promising you something that's going to be better and an improvement in care for the children in our community. It's going to happen. It's happening. So now you can trust us when we talk about building a new children's hospital. It's going to happen.
But there is no way it would ever been possible without the support and leadership of our partners in labor.
First of all, the institution that we have on Bryant is a fantastic institution, and the thought process of changing that hospital into a couple of floors at Buffalo General was disturbing for the community, but also we represent a lot of members of Children's Hospital, and they do the finest work in the area for pediatric, patients and mothers, and it was not just an issue really from a local standpoint and the union standpoint, but it was a community fight.
I had a very warm feeling for the hospital. My 6 grandchildren were born there, and I felt that it was a very valuable asset. I got involved because I felt I had to do my part to preserve that important asset.
Well, I had some experience in aviation, so I know the value of a good aviation program that can be used in an institutional way, as it was being used in other areas, and I thought it would be appropriate and very, very good for the continuation of the Children's Hospital.
Our doctors deserve the credit. They have led the way.
Tremendous amount of pride and gratitude. Pride in what we've been able to do as a community, as doctors, parents, community leaders.
And while it's the celebration of the last steel being raised, know that this will be the first place the entire community thinks of when it comes to taking care of our kids for generations to come.
Providing something for the next 100 years, something that will be a legacy for the spirit of Buffalo, and gratitude that we were able to work together to get this accomplished.
I drive by on a daily basis, and I've watched this building rise from the ground, and it gives me goosebumps to realize what we're going to accomplish for this community and in pediatric care going forward. And I'm proud and humbled to know that I played a small role in this. These decisions that were made to let's do this, let's move this hospital, let's build something that we can all be proud of and that people will think about for the next 100 years.
We are on the verge of making history, so we thank you. Thank you for helping us make our dreams a reality.